Question 3 on the health paper will ask you for explaining two ways in which two factors, and it will usually be similar. It's been similar for every other exam so far, or the exam board has said it could be different, but I would assume it's going to be talking about similarities here. Now, it's an 8-mark question. We're looking at 10 minutes for writing. We're looking for 2 paragraphs as always. And what you'll be given are 2 features from 2 different time periods. So it could be a feature, for example, from Revision Guide to the Renaissance period, and then it could be another feature from, say, the modern day, 1900 to the present day. And you'll be asked to give 2 ways that they are similar. So what's come up before? Well, these are the previous exam questions. And what I've done is I've grouped these up into 4 different categories: individuals, surgery, public health, medicine and disease. And we'll come back to this later on with some ideas that you can have when you're thinking of things to talk about. You can see that individuals has come up quite often, and that's why it's so important to know those key individuals that are named on the course that we've gone through. So let's pick a question. Let's do individuals. Explain 2 ways in which the works of Hunter and Lister were similar. Now, you're looking for 2 ideas here, and I'd think about broad themes. And linking in the other factors might help. Things like, were they helped by the government? Did they have any impact on the world of communication with books written and who read them and so on? Was their work impacted by war? And I've just got some bullet points here that you can think about as well. The area that they worked in. What methods did they use? For example, dissection, new scientific ideas. What opposition did they face? We'll come back to that later on because that's quite a good one. And what impact did they have in their particular field? Short term, maybe not as much. Long term, do we do things today because of them? So lots of different ideas, lots of different directions we could take this answer. Let's start off with an easy one, which is which area did they work in? And I've just started my answer off with a really clear theme. One way that the works of Hunter and Lister were similar was they both developed surgery. So there's a good starting point there. What I now need to do is I now need to talk about each of them and explain what they did with some good detail in. I'm going to take Hunter first of all, because chronologically it makes sense. And I've just given some information about what Hunter did. So I've written, this is as Hunter was willing to try difficult experiments to surgery. In 1785, he treated a man with a large lump or an aneurysm on his knee. Usually the treatment would be amputation. However, Hunter restricted the blood supply around the damaged area to see if new blood vessels would develop. This saved the man's leg from amputation. Hunter was keen to encourage other surgeons to follow careful scientific methods when developing their practice to lead to improvements. Now I need to do the same for Lister. Lister also developed the field of surgery by looking into causes of infection. Using Pasteur's germ theory, he realized that if he could stop bacteria entering the wound, there was less chance of infection. He used carbolic acid in his surgery on his tools and his hands, and this meant he was able to fix a severe leg fracture within 6 weeks using these methods with no infection. And the previous method would have been amputation. So you can see here, I could have talked about both avoiding limbs from being amputated, but that's quite narrow. Focusing on surgery gives me more that I can talk about. And now at the end of that paragraph, I'm just linking back. So overall, the work of both men was similar as they developed new surgical ideas which helped surgical success rates increase. And hopefully we can see in this answer, I've just highlighted some examples here where I've got really precise knowledge. I know what I'm talking about. I'm showing a good understanding. Now, if you are looking for a level 2 answer grade 4, just one will be enough. If we're looking for level 3, we will need to bring in another developed similarity as well. And if we're looking to get 7 or 8, those 11 4s, those really high grades, then I need to bring in the broader historical context. We've seen this with Elizabeth as well, but just showing we're understanding what's happening during each time period, what's knowledge like, what are beliefs like, and so on. And opposition's a really good way of doing that. So in my second paragraph, I've started off with opposition faced by both people. So Hunter was seen as unethical for his focus on dissection, which was seen by some as controversial. He was linked with grave robbing, and many people did not like or trust the fact he kept specimens and displayed them. He was also trying new ideas at a time when some doctors were still using Galen's outdated ideas, and so his ideas were seen as risky and unethical by some. So I've just got there that contextual knowledge. At the time, people were still using Galen's ideas in some medical fields, and he was seen as risky. And then I'm talking about Lister as well. Lister also faced opposition for trying new ideas. At this time, germ theory was a new idea, and many surgeons still believed in ideas such as spontaneous generation. Others did not want to change their routines about Lister's antiseptic ideas were unnecessary. So again, I've got the historical context there. I know what's going on at the time. That we've got the germ theory emerging, but people are set in their beliefs with things like spontaneous generation still, causing opposition for Lister. Again, I'm just rounding this one up. Therefore, both individuals faced opposition due to beliefs held during their time periods. So that's what answer looks like. Two clear developed ideas. See that I've left a gap in between each one just to make it really obvious to our examiner. And so if we look at the fields we've had with questions before and what's come up, just some prompts to help you think for each one. So for individuals, what area did they work in? Methods used, opposition faced, an impact that they had in the short term and in the long term. If your question's about surgical methods or surgery, think about the individuals during that time who influenced surgery. Problems that procedures faced during both times, pain or infection, and why. And what's stopping progress being made, like those incorrect beliefs, miasma, spontaneous generation. If it's to do with public health, you could talk about living conditions being poor and think about why. Again, bringing that factor of government and limited impact for a long time it has. You could talk about a lack of knowledge. For example, lack of knowledge on germs leads to poor drinking water, a reliance on miasma, or religion. If it's talking about something quite specific like hospitals or medical care, well, at these period of times, hospitals tend to focus on care, not cure. You could link in the impacts of religion, certainly from medieval times. And of course, during a lot of these periods, there's a lack of knowledge, and that means a lack of effective medicines. You could talk about that. And finally, medicine and disease. You could talk about what makes medicine slow to change. The lack of scientific knowledge, the lack of medical knowledge, the reliance on four humours from Galen. You could talk about the lack of effectiveness of medicine that leads to high death rates still as a result during several time periods. The amount of people impacted by the spread of disease, and you could say how high it was, and the lack of knowledge of how disease spread, thinking about your plagues, your choleras, and it links to actions taken that were incorrect. For example, things such as religion, flagellants, people whipping themselves, or with cholera, the government flushing the sewer without causing a big stink. So, just some final points for this one. Just check the questions carefully. They've always said the word similar before, but they have said it could be different. I know that's a pain, but just check that, okay? Also check the time periods being used. If they say 17th century, for example, they're talking about the 1600s. Just be aware of the different time periods they might talk about. Don't make mistakes. Think about broad themes in your answer. Link to the factors that might help you. How did government impact? How did communication impact? How was it hindered by religion? You're ideally looking for two developed ideas in those 10 minutes. Leave a gap by each to make it really obvious to your examiner where your new ideas come in from. And for those high levels, link to the wider context. Show you know what life is like in these historical periods. What's the medical world like? What's the lack of knowledge? What opposition's being faced? What are people believing? And how does that impact